A patellar tendon rupture of the knee is one of the most painful orthopedic injuries. In this video, I'll answer the question of a viewer about whether surgery is needed to repair the patellar tendon, and if so, when surgery is performed. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. And this video, like most of the videos I've recorded over the last few weeks, this is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Now, the patella tendon is the tendon just below the kneecap that connects the kneecap, the patella, to the top of the tibia. It helps to extend the knee and perform a straight leg raise. And it's injured in a variety of ways, very similar to ACL tears, non-contact injuries, landing awkwardly from a jump, in theory, running, planting your foot, changing directions. And it's typically people in their 20s and 30s that do it. And a lot of times it happens in sports and exercise. It always needs surgery to repair it. It is not an injury that you could put in a cast and let that tendon heal. It probably would heal, but that knee would become basically completely stiff. You'd have to basically lock that knee out straight while it heals and do that for 6 weeks, maybe 12 weeks. And by the time you took that cast off, you'd have really no ability to get range of motion back. So we always fix that surgically. And generally we fix that as soon as possible. It doesn't have to be that night or that day necessarily, but within the next day or two. The longer it goes, potentially that surgery would get harder. And plus it's very, very difficult to do your normal activities, walking or anything else. Right after you did it, maybe you'd go to an emergency room or emergent care. They'd put you in a knee immobilizer or brace that basically would hold your knee straight for a few days until surgery. But yes, you would do that surgery very quickly after the injury, usually again within a few days. Then once that surgery is done, a repair of that patella tendon, the process starts to basically let that heal, get range of motion back, get strength back. It's a long recovery, and I've talked about that in other videos on my channel, so check that out if you're going through it. But just know, if you rupture your patella tendon, and this is not just athletes, this is pretty much everybody, it's going to be something that the orthopedic surgeon is going to say you need to do surgically or to treat surgically and do fairly quickly. Now, if you have an orthopedic injury and you want to hear about other treatment options than surgery or cortisone shots, and maybe not for patella tendon rupture, but depending on what your problem is, you can click the link under this video, in the description under this video. You fill out the contact form and you can potentially schedule an appointment with me. I'd also love to hear your experience with your injury, so leave those in the comments below this video. If you do leave a question in the comments, though, just know I can't offer you medical advice, but I do try to answer those questions in future videos like this one. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my live streams, my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.